Hi, I'm Dr. Janaki Srinath, Senior Consultant Nutritionist. Today I would be talking about glycemic index diet. Rather, the concept of glycemic index, we commonly see that nutritionists and doctors advise you to take low glycemic index foods to cut down on body weight or body fat percentage, or to maintain blood sugars, or to control your hunger. And many of the popular diets like zone diet, sugar control diets often recommend the use of low glycemic index foods. In the world of growing obesity and diabetes, especially in India, particularly in the youth and middle aged, it is always better that from the childhood we inculcate the habit of eating foods which release the blood sugar slowly. Low glycemic index is a way of comparing how a particular food can increase, or the levels, how much it increases blood sugar in comparison with pure glucose. So we generally classify any food less than 55 as low glycemic index food, between 55 to 70 as medium glycemic index foods, and above 70 as high glycemic index foods. So it is better, anybody who is trying to control weight or control blood sugars or central obesity, or has a family risk of high diabetes, it is better that the child or the entire family shifts to low glycemic index foods. For example, compared to polished rice, brown rice is low glycemic index foods. Many of the common foods like vegetables, milk and milk products, nuts are all low glycemic index foods. Medium glycemic index foods are items like cooked items like pesarattu or dalia upma, brown rice, or a slice of bread. These fall into medium glycemic index foods. High glycemic index foods are typically sweetened fruit juices, or ragi malt, honey. These food products increase the blood sugars very sharply. It is better that we always prefer a combination of low glycemic index foods with medium glycemic index foods, so that the meal does not increase the blood sugars very sharply. Shown that, lot of research has shown that, especially in women who have polycystic ovary syndrome or who have issues with menstrual disorders, it is better to choose low glycemic index foods throughout the day. In India, as carbohydrates or cereals happen to be the base of our diet, because most of our items are made with cereals. The base for lunch and dinner is cereals. So introducing and learning about the concept of low glycemic index and preferring foods like millets which have low glycemic index, especially like barley, foxtail millet, oats, brown rice. This low glycemic index can be used if used as a base of our diet, and if we try to use less polished items like dals with husk, we can easily control our hunger and also the unwanted triglycerides or bad cholesterol in the long run. patients on insulin or insulin pump need to combine both the glycemic index and the glycemic load concept to control their blood sugars. And gestational diabetic women also can use the glycemic index concept to understand their body type and how to control the blood sugars. But people looking out for just to control the weight and eat healthier meals not only need to look into low glycemic index foods, but they also need to look into the portion sizes also. Shifting to low glycemic index could be an option for healthier meals, but if you are very focused to reducing your weight, not only shifting but looking into the portion sizes and which takes care of the glycemic load concept would help you in the long run. ఈ మధ్య బ్లడ్ ప్రెషర్ కి గురి అయ్యే వాళ్ళ సంఖ్య చాలా ఎక్కువ పెరిగిపోతుంది. యుక్త వయసు నుంచి మిడిల్ ఏజ్డ్ వాళ్ళు, స్త్రీలు, అంటే అందరికీ కూడా ఈ ప్రాబ్లం అనేది ఎక్కువైపోతుంది. ఒక్కోసారి ప్రెగ్నెన్సీలో కూడా బ్లడ్ ప్రెషర్ ఎక్కువ అవ్వడం